And now we have Doug Boysen, who is Executive Vice President, Chief Administrative Officer with Samaritan Health Services, going to give the private sector provider side perspective on how things are going.
So Dr. Eby said that this was supposed to be entertaining. I didn't get that memo. So actually, I must admit, I'm kind of a last-minute fill-in. Dr. Mullins was supposed to be here tonight, and he regrets that he can't be here, but he's undergoing oral surgery right now. So I'm standing in tonight, and I was asked to talk about kind of how I view the primary responsibilities of the board. And before I get into those specifics, I'll talk generally, just kind of my experience with being on the board of the CCO. I think it's a great group, and I'm honored to be part of that group. I think it's a very collaborative group. I think it's a good example of shared governance where we have independent community members, independent practitioners. We have folks from Samaritan. We got folks from other systems. We have folks from local government as well. Each of them bringing their own perspective to the table. I think each bringing the expertise that helps us come up with a better solution as a whole. So it's been great being part of that. I think the other thing about the board is what I've seen and what my experience is, they're all very sensitive to the needs of the communities and very in touch with the needs of the communities. So I think that brings a lot of value to the CCO. Now, specifically kind of what I view the role, the primary role, you'll all see on your table, there's a diagram, and I think it says the board directs the goals and policies, and I think that's absolutely true. I think to be a little bit more specific around that, I look at, as a board member, the triple aim is what we're all shooting for, right? And Commissioner Hall mentioned that, better health, better care, lower costs. Sounds almost impossible, but I think through innovation and coordination, those are some of the things that we can start accomplishing. But it's not just the triple aim, it's the triple aim laid in context with the needs of our communities and trying to figure out what are the most important needs. And as a board member, we really rely on stakeholders. We rely on these types of meetings. We rely on all the committees that are involved with the community health assessment and taking that feedback up to the board so we can really fine tune and prioritize what are the needs and then how do we accomplish that. The other thing I'd note, I think a big thing that we're always focused on is, the overall vision of the CCO. And as we hear different ideas, different innovation projects and things Kim was mentioning, how do we prioritize all those good ideas? Because there are a lot of good ideas out there. There are only so many resources, and we only have so many people, human power, to put these things together. And that really is the job of the board with administration to figure out, okay, what is most important at this point in time, and then what things do we stagger over time. And then lastly, I think we have to look at it to make sure that the CCO is sustainable in the long term. And that can be somewhat kind of the more boring part, but a very important part, that we make sure that financially we're not upside down, that the CCO is making good, prudent business decisions. Today we had a board meeting and we passed the budget for next year, and that's a very important thing the organization has to follow. And then I guess lastly, I'd just say, as part of sustainability is making sure that the CCO is complying with the law, that we have a good compliance program, and that it's acting with integrity, because if it wasn't, it wouldn't be very sustainable. So those are the things that we look at. As someone that's been in healthcare for a while, what I find most exciting, though, being part of the process, is just the islands coming together, the big land masses I think you referred to, because there's a lot of land mass out there. And as I sit around the table with people from the county and the providers, weren't always talking. A lot of people doing really good things. And I remember when we were first starting up the CCO, and Kim was putting together an inventory of all the great nonprofits and governmental agencies that were doing things out there that were part of that care continuum, all doing great things, but none of us were really talking. And we're finally talking. And I think, that's how we're going to get to the triple aim. It's through that. So, thank you.